I'll move over to one of the evaluations now, which is Best Start for Baby. That's the program we are evaluating currently in Camden Council. I'll be doing the presentation on this bit, and then we've also got Susanna from Camden Council who will be there for the Q&A. So what is Best Start for Baby? It is a program that was developed in 2023 and is borough-wide in Camden since April 2024. It offers up to 8 enhanced health visiting appointments, so from antenatal into 2 years of age. It also offers there's other strands to it as well. So there's stay and play baby bonding sessions that are open to anyone. There's also targeted support and also specialist support, especially around perinatal mental health services or trauma-informed therapy. As Lorna just outlined, the contacts are underpinned by the Healthy Child programme, and they're delivered by lots of different practitioners across the community, across psychology, across health. So it's really a sort of huge interdisciplinary programme. And a big part of the programme is really the access to universally embedded clinical psychology and the ability to step up that specialist support as is required. What we really focused on this evaluation is looking at the 8 enhanced appointments. So I know Best Start for Baby offers other strands as well, but we really just focused on those 8 enhanced appointments. So I'll come back to that when I talk about the evaluation. Best Start for Baby tries to improve access to support in the first critical 1001 days of life and reduce health inequalities. In doing so, it really tries to enable the right support at the right time and identify emerging needs early and then intervene early to stop escalation. It's coordinated and relationship-centered care, and it's health, psychology and community services coming together. And as I mentioned earlier, the big focus here is on psychological support as well, and normalizing conversations about emotional well-being, infant development and parenting, and making people feel safe when they want to ask for support. And these are the appointments. These are the Best Start for Baby appointments. So there's 3 home visits early on, and then there's 5 additional appointments that are delivered in the community setting, so local family hubs. So I've circled the ones that are addition to the sort of statutory ones, and just it's a bit confusing, but the 9-month appointment is in Best Start for Baby, the 9-month appointment equals the 8 to 12-month mandated review. So the 12-month appointment is the additional Best Start for Baby appointment, and that would be important when we look at some of the data. Quick look at the Camden population. There's about 220,000 people in Camden, just under 10,000 under 5s, very ethnically diverse. White is the white people or the biggest representation in the population, but there's 20%, about 20% Asian, 10% Black people, and also mixed ethnic groups. And if you look at the sort of spread of deprivation, you can see there's not really there's kind of pockets of deprivation all across Camden. There's no big sort of area of more deprivation and less deprivation. And you can see that children from Black and Asian backgrounds are significantly more likely to live in the most deprived areas compared to white people. Something that is highly prevalent in Camden and really relevant to this evaluation is that there's a high population turnover in Camden, with many people moving in and out of Camden, which does pose a challenge for kind of recording health visiting and making sure everyone who is eligible gets their appointments. So the questions we set out to answer in this evaluation is: what is the reach of Best Start for Baby, and to what extent does Best Start for Baby reach families? And what are the barriers and facilitators to service engagement? And are there any patterns across the 8 appointments that are significant? And we looked at, and this was, we had quite a lot of chats with the team in Camden and tried to really narrow down which groups would be of particular interest. And these are the groups that were of particular interest for the team in Camden: Black African and Black Caribbean families, Bangladeshi families, those who have experienced perinatal mental health difficulties, dads, and families who live in temporary accommodation, and that includes families experiencing homelessness and refugees. So we really focused on those 5 groups, and we really focused on equity and reach and better understanding that. So what we did is we looked at existing data on appointment attendance across those 8 appointments, and we also did focus groups and interviews with families, especially the families of those 5 groups, and staff. So we had 50 people in total. To mention is also that we're still working very closely with a public involvement group, and they've been great. They've had a mix of backgrounds and experiences with Best Start for Baby. Some of them have moved into the area, some of them have a child who has not gone through Best Start for Baby, and the second one has. So it's really good to hear the different experiences with the programme. And we meet every 3 months, and we just had one meeting this week, and they're currently helping us formulate the recommendations for the valuation. So they've been really great to work with. Early findings, first glance at what we found. So I'll start with the sort of quant aspect, looking at the attendance across the appointments. This shows the overall engagement and what proportion of families are attending all appointments. What does the engagement look like across the whole service? So this shows that about 2/3 of families are engaging fully, attending all appointments that are offered, and about 1/3 of families are only engaging partially. So I'd be really interested to hear, possibly later in the Q&A or in the chat, if that's something that you sort of recognise in your service, that sort of pattern, or if there's anything surprising there for you. Be really interested to hear. And this looks more closely at attendance patterns across the individual appointments. So the blue bars show the additional appointments that are offered as part of Best Start for Baby. And you can see that there's very clearly a sort of drop off for those appointments, the additional appointments that are offered. And the qualitative data will show more, but early explanations could be that there's much better sort of processes in place, contacting processes and recall processes for the mandated appointments than for the additional appointments that were added with Best Start for Baby. So really interesting to see that sort of pattern across these appointments. And looking a bit more about how the appointments are taking up across different demographic groups and localities. Interestingly, engagement was broadly similar by gender, ethnic group, and deprivation. There were some differences based on the location of the borough, but they weren't really statistically significant, and it could be due to simply ward level differences in recording local pathway processes and population movement. So I guess that shows the importance of qualitative data, speaking to those groups, also feedback from the public involvement group, and possibly thinking a bit more about intersectionality and being a bit more specific about the sort of ethnic groups or different parent groups that we want to get insights from. So moving on to the qualitative data, thinking more about the barriers to service engagement. These are early findings from the qualitative data, and one of the barriers is lack of awareness of the appointments on offer. This is because of not being contacted, not being followed up to book, and there could be some logistical issues with this. I'm very aware that in Camden there's several databases to record attendance, different admin teams depending on what appointment it is, and it's hard to get the messaging and the language consistent. So that could play into this. Then limited understanding of what appointments involve and what the benefits of health visiting are. Again, that's something the public involvement group really stressed, that health visiting seems to be a bit of a mystical thing amongst parents, and it's not really talked about that much. So people don't really know what to expect and why there might be a benefit to the visits. The availability, location, and time of appointments wasn't always helpful. Too far from home. For instance, someone from the public involvement group recently said, it takes 2 hours to leave the house for a 5-minute appointment. It's really difficult. And then language barriers, especially challenges with existing translation services. And these the majority of the barriers do disproportionately affect the 5 target groups that we looked at earlier. When people do access the service, the feedback has been really positive, and people especially really valued the health visitors, and the sort of prompting about talking about mental health, and they felt safe asking questions and asking for help, which is really great to hear. Parents really appreciated the content and breadth and the number of appointments, and they also appreciated the linking between services, especially other Best Start for Baby services or wider services. So that's about it. Those were the early findings. The quick summary is about 2/3 of children attend, so there's full engagement, whilst only 1/3 partially attend. The attendance which is higher at mandated appointments compared to the additional appointments. There wasn't a huge difference between gender and broad ethnic group, but a level of deprivation, and parents, if they were able to access the service, really thought it was really good. And the report should be out sort of end of summer, sort of autumn. So if you're interested in getting the full report, drop me an email. I'll put your email in the chat and I will send it to you. So thank you very much for listening.